So I've heard patients say sometimes, so my dentist says I need a crown, but my tooth doesn't hurt at all. Why do I need a crown? It's a little tricky for us dentists sometimes to talk to patients that we will look at a tooth, the radiograph will look under high magnification, we'll see a tooth that has tons of cracks in it, defects, looks like a tooth that's going to shatter into 1,000,000 pieces at any time. On occasion, those teeth don't hurt at all. They may have a giant silver filling, a giant white filling, or minimal fillings. Sometimes a patient bites into an olive pit 6 months ago and the tooth hurt for a while, didn't hurt anymore, but I can see a giant crack. There are occasions where a crown or full coverage of a tooth is going to be the best thing that we can do to preserve a tooth long term. If we don't do it, we could lose it. They do have some relatively new technology in dentistry, and it has to do with getting a crown the same day that you get it prepared. And the machine is called a CIRAC. A CIRAC machine has to do with a milling unit and digital imaging, 3D digital imaging, in order to get a crown made the very same day they prepare it. Patients may be very familiar with the whole aspect of, I had a crown prepared one day and I left with a temporary. The temporary fell off once or twice, sort of a nuisance, and then a month later I have my crown. There is no question that this technology of CIRAC, or milling a crown in one day, alleviates the whole aspect of a temporary falling off, or being careful with a temporary and having to come back to the dentist at all. The problem with the technology is not as good as doing it the old-fashioned way of putting a patient in a temporary, having the crown made at a lab, and using old school, I guess these days it's old school, impression techniques. A quality impression by our dentist supersedes the quality of the imaging currently with the technology we have today. Unfortunately, the CIRAC technology tends to get overused sometimes because a dentist can save a lot of money by getting the crown made in the office instead of at a lab. Unfortunately also, dentists will tend to force feed a lot of patients into the funnel of getting that crown made by them for money savings, convenience, and other things. And do we see more failures with these crowns from patients who have had it at other offices than other crowns? Yes, I do. I see a lot more failures. Do I see a lower standard with these crowns? I see that as well. This is why we don't have it at my office. Sturner Dentistry, I've tried these CIRAC crowns. I've tried a CIRAC unit. I just saw all of the flaws in the technology and that it's not ready. We're still probably 5 to 10 years away from it being appropriate, at least at the high level that I need to see here at my office.